To practice good hygiene, the most important thing to remember is to encourage respiratory etiquette. What does that mean? That means covering our cough and our sneezes, not with our hand, but with a tissue or your sleeve. One of the common mistakes people do use when they sneeze into a Kleenex is that they carry that Kleenex around with them, maybe for an hour, maybe for 5 minutes. It's important to dispose of the Kleenex and then wash your hands. Wash your hands frequently. Easy access to tissues and running water and soap or alcohol-based hand cleansers can really reduce the spread of disease. Continue to practice good hygiene by keeping surfaces clean. Clean surfaces with frequent hand contact, such as doorknobs, countertops, areas in your home and in your office, keyboards and desktops. Use your current cleaning agents that you already have on hand. Many times, organizations and even in our home, we try to do additional disinfection beyond routine cleaning, but the reason this is not recommended is because it is hard to keep up with. By keeping your routine simple and keeping it constant is more effective. One of the most important things we can do to reduce disease activity is to keep sick employees home, or to stay home ourselves if we are sick. In our active environments that we all live in today, this is something that many of us ignore, but this will be a very important practice as we move through this influenza season. If you or an employee cannot go home immediately, you or they should be separated from other employees or family members. But remember, stay at home. Advise all employees or community members to stay at home if they are sick until at least 24 hours after they no longer have a fever of 100 degrees Fahrenheit or more, or signs of a fever. Those include chills, a headache, a cough, a sneeze, a sore throat. All community services and businesses should also be reviewing their pandemic flu plans. Review sick leave policies so that if an individual is sick, that they are not negatively impacted by this. Provide flexible leave policies so that if a member of your staff has to care for a family member, they're allowed to actually leave work to do that. And encourage employees to get vaccinated against the seasonal flu and then the novel H1N virus when the vaccine becomes available. Make tissues, soap, and alcohol hand cleaners available, and cross-train employees for critical business functions so that if you do have a spike in your absentee rate, the critical functions of your business can still move on. A great resource for all communities and businesses is flu.gov. There they actually have assessment tools where you can see how ready you are for this upcoming event. What are we doing here at the DuPage County Health Department? Well, we are in an aggressive planning stage for a vaccine campaign. As we said, the vaccine is expected in mid-October. We do anticipate 2 doses. Again, until testing is complete, we are using this scenario for all of our planning purposes. What are our priority groups? Pregnant women, healthcare workers and emergency medical responders, and people caring for infants under 6 months of age. Why? Well, because children that are from newborns to 6 months aren't eligible for vaccine. Their immune systems are not mature enough to handle it. Therefore, their caretakers need to be immunized so that they do not spread the disease. Children and young adults from 6 months to 24 years of age. And finally, people aged 25 to 64 years with underlying medical conditions. Again, very different than the seasonal flu, where usually our focus is on individuals 65 years and older. As we plan for distribution of the vaccine when it becomes available, we look at possible scenarios and how we would utilize vaccinators in our community. What we look at is a public-private model. We look at scenarios where supply of the vaccine will be high and disease activity will either be high or very low. You'll see us use multiple providers. What we're working on is scenarios that will allow you to get your novel H1N1 vaccine at the same place that you receive your seasonal flu vaccine. But if the supply is low and the disease activity is either low or high, you'll see us move into more mass vaccination clinics. Again, utilizing a variety of providers to help us distribute the vaccine, but to try to distribute the vaccine as quickly as possible to the highest priority groups. The role of any public health agency is really twofold, one of education and one of surveillance. When we talk about surveillance, we're talking about disease monitoring, which is really a systematic collection, interpretation, analysis, dissemination, and consolidation of data pertaining to a specific disease. The disease we're monitoring right now is the novel H1N1 virus. So our data collection, interpretation, and analysis surrounds this virus. We use a number of indicators to monitor on a daily basis the disease activity in the community. Essence is a syndrolic surveillance tool that we use with a hospital in DuPage County to actually assess daily ER complaints to see if they are similar to the complaints you would see around the novel H1N1 virus. We collect student absenteeism information from every school in DuPage County. It's broken out by total attendance and flu-like illness, so we can determine the spread within the community among children. We monitor medication sales through a national database of over-the-counter cold and flu medication to see if we see spikes in the retail operations. And we work on a weekly basis with some of our medical community to determine what the flu-like symptoms are across the community and doctors' offices. We also have our own case reporting division within the DuPage County Health Department of where hospitalized or severe cases are reported for investigation. And we keep our own employee absenteeism so that we can monitor our own health of our community. And finally, on a daily basis, we check with our hospitals to see what their bed capacity is and to determine how those beds are being utilized to see if we have spread of disease. This daily monitoring helps us determine whether we have mild, moderate, high, or severe disease activity. What you see here by the X's on this example here might be what a daily report would look like, but does not necessarily indicate what our current disease activity is in our community. As I said, communication and education is also a very important pillar within public health. In order to ensure you are getting the most current information, it's important for every DuPage County resident to go to protectdupage.org. Currently, our topic is prevention and heightened hygiene, but as the vaccine becomes available, we'll be providing information on protectdupage.org. Who is the site set up for? Everyone. Residents, employees, students, parents, businesses, and municipalities. That way we all stay connected. We've created outreach kits for schools, for businesses, and for community settings that have fact sheets and posters in English and in Spanish. The presentation that you are hearing right now is available on this website. And we have a website widget that will link right onto your own website in your business, in your school, or on your community website so that all of your customers and clients can get to the most up-to-date information. Why? During an emergency, the more educated and prepared the public, the lower the health, social, and economic impact. As we work through phase 1 of the novel H1N1 event, it's important to stay calm and stay healthy. Practice good hygiene techniques and keep ourselves healthy as we wait for the arrival of the vaccine.